Excessive smoking is seen as one of the major contributors of cancer among Indigenous people. According to Health Canada reports, about 85% of lung cancer cases is as a result of smoking. The report also says that 30% of cancer-related deaths among Indigenous people is due to smoking. Smoking has also been linked to pneumonia and cervical cancer among Indigenous women. A recent Health Canada report showed that about 57% of Indigenous adults and 54% of Indigenous youths smoke. We know from other data as well that smoking has reduced substantially in Canadian society, but unfortunately, this prevalence of smoking still remains substantially stable among Indigenous people. A lot of data, articles, and videos online talk about the issue of excessive smoking among Indigenous people in a very individualized manner. And this manner is related to the biomedical model, which is more disease-focused in that it attributes and blames the victims that are ill, in this case, Indigenous people. It blames them for the prevalence of smoking in their community, instead of looking at the broader social determinants of this prevalence. Looking at the issue of excessive smoking among Indigenous people in a social determinants perspective takes a holistic model in exploring the reasons and the causes for this prevalence. Using a social determinants perspective, it's important to understand that the issue of excessive smoking among Indigenous people is a reflection of the greater social inequalities that Indigenous people face in the society. This issue of social inequalities faced by Indigenous people in the society dates back to the era of colonization. In this era, Indigenous people are faced with discrimination, are faced with stereotypes. They are stripped off of their cultural beliefs, they're stripped off of their cultural practices, and even Indigenous children were being sent to residential schools where they were abused and they were ill-treated, and they had to endure poor and inadequate accommodation. Aboriginal children were forced to attend these residential schools, leaving their family, their cultural practices, and their language behind. They were faced with abuse, they were faced with neglect, they were faced with inadequate living conditions. Colonization has left a legacy of mental anguish among Indigenous people, and as a result, they turned to things like illicit drug use and excessive smoking as a means of providing immediate gratification for the stress that they were put through. Indigenous people are also subjected to poor socio-economic conditions, and these conditions include things like unemployment and underemployment, inadequate housing and accommodation for them, issues of poverty and low income in Indigenous families, and also issues of social exclusion. Another important social determinants to consider here is the fact that Indigenous people occupy very limited seats in the government sectors. They also are not as much as they are supposed to be in the educational fields, in the social institutions, as well as in health institutions like hospitals. And as a result of this, they feel excluded from the general society. They feel that they don't belong in the society, and they feel that they're not given a say in issues that concern them. This could be quite stressful for them, as they feel out of control about issues that directly concern them. And as a result of this, they return to things like excessive smoking just because they want to gratify themselves and reduce the stress that they are going through. Now, speaking about exclusion in the healthcare institution, it is reported that Indigenous people feel very reluctant to visit healthcare systems because of the racism and the discrimination that they go through by healthcare officials.
Michelle Lebrac was recently found to have a fractured pelvis, but it took 3 trips to hospital before she received that diagnosis.
You're not treated as well as like the white people that come in, a native or just seem to be turned away.
Not her first bad hospital experience. Once, she went to see a doctor about stomach pain. They discussed her drinking problem and homelessness. He gave her this. When she complained, the hospital apologized, but she felt humiliated.
It's discriminating against natives, I'm pretty sure.
Discrimination against Aboriginal people is, in fact, pervasive in the healthcare system, according to this new study, which says ongoing racism has had a major impact on Aboriginal people's health. The study's author suggests many healthcare workers have, quote, unconscious pro-white biases.
It bothers me that people think that it's okay to pretend that we don't have these issues in our own backyard.
The study found Aboriginal people often just avoid medical care to avoid discriminatory treatment.
Some other medication that I take and use.
Carol McFadden put off breast screening for years after a doctor suggested she needn't have come to a clinic for examination. She recently discovered she has stage 4 cancer.
You're somebody that's wasting their valuable time that they could be spending on, somebody else more deserving of the healthcare system.
Another reason why Indigenous people feel reluctant from visiting healthcare institutions is because the healthcare systems and the health treatments are not culturally sensitive. And even some of the trainings, the treatments, and therapies available for Indigenous people that smoke excessively are not culturally sensitive to the underlying causes of this smoking. Even some of the training and the therapies and the treatment methods available for Indigenous people that engage in excessive smoking are not culturally sensitive to their needs, and as a result would show little or no effect in alleviating the issue of excessive smoking among them. And even if it shows effect, there's higher rates of bounce back to excessive smoking among Indigenous people. Understanding the issue of smoking-related cancer in a more social determinants perspective will be effective in coming up with probable solutions to alleviate these occurrences. One of the probable solutions is to appoint more Indigenous people in government sectors. This way, Indigenous people feel more included in the decision-making process concerning the inequalities that they are going through in relation to the political system. A barrier to appointing Indigenous people in government sector comes from the reluctance of Indigenous people to vote. Studies have shown that Indigenous people are less likely to vote during elections because they feel excluded. They feel that the political system has never been in favor of them and will never be in favor of them, so they don't vote. One way of overcoming this barrier is by creating more awareness to the idea and to the benefit of having more Indigenous people in government sectors. This way, Indigenous people are more likely to vote and they feel more included in the decision-making process concerning their health and well-being. Another probable solution is to encourage education among Indigenous people, and this will come from reducing racism, reducing discrimination, and reducing social exclusion in educational organizations. Another way of ensuring this is to employ more Indigenous teachers or educators in educational systems. This way as well, Indigenous people feel more included and are able to relate to their educators. Hence, encouraging them to stay in school, encouraging them to feel less stressed, and even encouraging them to pursue the adequate education necessary for them to attain the good employment that will cause them to be change makers among their communities. These doctors are able to relate to Indigenous patients on a better scale by understanding the issues that they are faced with and by dealing with them in a more holistic manner as opposed to in a biomedical manner.
It's a plight 19-year-old Dubbo local, Kyani Biles, is determined to change. She's in her second year of a medicine degree at the University of New South Wales in Sydney, and is back home for the uni break.
So when do you go back? It's 2 weeks.
Kayani Biles is studying to be a doctor because she wants to improve the health problems plaguing Indigenous communities like her own.
We've got to do two things. We've got to produce doctors that are generally more conversant with Aboriginal history and the way to deal with Aboriginal people, and more Aboriginal doctors.
Now just let me know if there's any pain.
Kayani Biles is one of 150 Indigenous Australians studying medicine in universities across the country. Of those, 27 are at the University of New South Wales, or UNSW.
You should see the ear canal opening up in front of you.
These students are learning how to do ear tests to diagnose otitis media, or ear infection, which is especially prevalent in Indigenous children.
It causes lifelong effects. So I guess learning things like that, they're just little things you can take away. If you help one person, that's one person that's not going to be, left deaf.
I wanted to be a doctor since I can remember, but I was emboldened by the issues that face the Indigenous community. When I became aware of them, I was motivated. That's what further motivated me to go to med school. They tend to assume that pre-medicine or Indigenous entry is easy. It's not.
Brendan Phillips is mentoring Indigenous high school students in the hope that they will also study medicine. He believes while there are about 140 Indigenous doctors practicing in Australia, many more are needed.
I personally have never been treated by an Indigenous doctor, but I would love if I could be.
Why is it important for you?
Because they know where I'm coming from. An Indigenous doctor would know my cultural background, maybe not personally, but would know the issues that are important to me.
I've got a lot of friends, or a few friends, that would prefer, not to go and see non-Indigenous doctors, because I think it does not so much a mistrust, or that it's more of a feeling of judgment or embarrassment.
As for solutions, the study recommends cultural safety training for non-Aboriginal health professionals and
we have the cedar, there's some sage in here.
applauds steps like this, a newly created sacred space at St. Paul's Hospital where patients like James Raven, HIV positive and suffering from hepatitis C, can use traditional Aboriginal medicines.
I feel that if it wasn't for the Creator and these people that are here today, I would be pushing up daisies.
Here, they say, when healthcare professionals and patients work together, all kinds of healing takes place.
Mamatakuyase.
Duncan McHugh, CBC News, Vancouver.
This will result in Indigenous people feeling more confident to come to healthcare institutions for screening and for a more proactive way of preventing issues like cancer as a result of excessive smoking. Perhaps having more schools and more educational systems generally in Indigenous communities will help to combat the issue of lack of education that Indigenous people are faced with. This way, they are less likely to drop out of school because they feel more in tune with their environment. This way, they are also less likely to have low self-esteem. And this way, they feel more included. This would reduce the stress that they are going through, if not eliminate it, and reduce the tendency for them to turn to things like illicit drug use and excessive smoking, which is hazardous for their health as it leads to cancer. It's very important to raise more awareness about the issue of social inequalities that Indigenous people are faced with in today's society and the underlying causes of these issues. This way, whatever negative prevalences or negative stereotypes against Indigenous people are able to be understood as caused by societal conditions and the economic conditions we are faced with.